Youth with Chronic Pain, a presentation by the Data Visualization Group. What is chronic pain? Chronic or persistent pain is the pain that carries on for longer than 12 weeks, despite medication or treatment. Most people get back to normal after pain following an injury or operation. But sometimes the pain carries on for longer or comes on without any history of an injury. Patients describe chronic pain as a stabbing, aching, or burning feeling. The symptoms and causes of chronic pain vary from person to person and can vary by age. The intensity of the pain can fluctuate without any set patterns as well. Living with chronic pain can be lonely and isolating, especially for the youth. It can affect all aspects of their life and make it especially hard to pay attention in school. It can also limit their social interactions because their friends are not able to relate with their experience. As a result, anxiety and depression is quite common among chronic pain patients. Clinicians adopt a 3P approach to help patients with chronic pain, which can include massages, physiotherapy, mindfulness, or medications. Patients are also encouraged to use techniques such as deep breathing and guided imagery to reduce pain-related fears and stress. Designing effective treatment plans for youth with chronic pain is challenging. Little is known about how symptoms vary on a day-to-day basis. The relationships between mental health symptoms and functional capacities in the context of chronic pain are also unknown. How is the data for treatment collected? The data collected for chronic pain in youth is mostly retrospective in nature. It is based on a single point in time when patients meet the clinicians. Such accounts can be affected by recall bias and are not well suited to address how the experience of chronic pain changes over time and across contexts. With COVID-19 related clinic closures, collecting information from patients in a timely manner has become even more challenging. Subsequently, our faculty consultants are using the Ecological Momentary Assessment or EMA approach to sample patients' behaviors and experiences in real time. As a part of the EMA data collection method, the patients are asked to fill a questionnaire 3 times per day using their smartphones. The questions are related to the quality of their sleep, physical symptoms, mental health, and peer interactions. What does the EMA data look like? The EMA data collection method can generate huge number of data points even for a single patient within a week. However, such large data sets can be difficult to understand and may get confusing for the users. Understanding the data and drawing inferences can be quite challenging for clinicians as well. This presents an opportunity for utilizing data visualization techniques so that information becomes more consumable for users and clinicians alike. Data visualization is used across many fields in our day-to-day life, from business to education to sports and much more. Such visualizations can help the user to understand complex topics through interactive mediums. Use of data visualization is not uncommon in the healthcare industry as well. Many mood and pain tracking apps are currently available in the market. Clinicians also encourage patients to maintain journals so that patients can articulate their feelings and track their progress. Tracking progress can help the patients to identify patterns in their symptoms, figure out triggers, and pinpoint treatments that work for them. Our role on the project. Our team's role on this project consists of providing feedback on the data collection survey to improve its usability. Additionally, we aim to develop personalized data visualizations to improve the understanding and engagement of youth dealing with chronic pain. Through our visualizations, we seek to motivate behavior change and improve the patient's daily lived experience. To achieve these goals, we are outlining the user needs and creating personas for the users. We are incorporating inputs from the clinicians to develop visualizations that resonate with young users. We are also documenting feedback on the survey that the patients will fill so as to make it more user-friendly. Current progress. We have completed the empathize and define phase of the design process at present. At this stage, we have outlined the user needs through analysis of video recordings with the patients and caregivers. In order to develop a comprehensive understanding of the user needs and their lived experience, we also conducted interviews with 2 clinicians who specialize in working with young chronic pain patients. Based on the analysis of interviews and literature review, we've developed personas for a young person dealing with chronic pain, their caregiver, and a clinician treating the patient. These personas will help us to outline the user needs, their experiences, behaviors, and goals. Our team participated in the survey that the patients will be undertaking to get a first-hand experience of the process. We started collecting feedback on the survey based on our observations and started outlining the feedback in a document. We find that the limited flexibility in timing to fill the survey makes it quite challenging for the user. The surveys may also trigger negative emotions depending on the state of the patient. We will be outlining our feedback on the survey and discussing it with our faculty consultants. The overall intention of the feedback is to ensure that the ease of use for the survey is high so that there are not any gaps in data collection due to user drop-off. We are also creating a repository for designs from various apps to gain insights on visualizations which would have the most appeal for a young user group. These design inspirations will guide us through our ideation and prototyping phase. Speaking of the timeline, we plan to have a prototype ready by the second week of March, and we plan to complete user testing by the end of March this year. In conclusion, our goal is to develop visualizations for the youth dealing with chronic pain, which can resonate with them and help to improve their daily lived experience.